So the first thing I would do is check my doctor's orders for my patient to see what I need to do, and I need to place a Foley catheter. So I'm gonna gather my equipment and knock on the patient's door. Hi Alice, my name's Sierra. I'm gonna be your nurse. The doctor's ordered that we get you a Foley catheter today. So if that's all right with you, we're going to get that placed. Alice is a little messy. Okay, so I'm gonna check Alice's name band, and it says Alice in Wonderland, so that's perfect. I have the right patient. So Alice, have you ever had a Foley before? She's gonna say no, so I'm just gonna explain to her. Okay, this procedure is like a little bit uncomfortable, but I'm gonna do my best to help explain to you what I'm doing and make it the best procedure possible. So then Alice doesn't have any questions. She just wants me to explain what I'm doing, so I will tell her that. Okay, so Alice, the first thing I'm gonna do is just kind of uncover you here. I know that this is uncomfortable, and I'm just gonna kind of expose you a little bit, but I'm just gonna, I'd wash my hands and put on gloves before I start touching Alice, because Alice has a disease. Just kidding, Alice doesn't have a disease, but if she does, I don't want it. If I have a disease, Alice doesn't want it either. So, gloves are good. Gloves, washed my hands, got my gloves. Okay, so I'm gonna position Alice in this little froggy position. Alice will be real when I do this, and he'll help me more, so very good. I'm going to start by doing Pericare. So I'm just gonna go on the right side, front to back, throw my wipe away. The left side, front to back, and throw it away. And I'm gonna spread and go in the middle and wipe it front to back. Okay, if she had a dirty chuck or brief or anything, I would change that also. But Alice is good to go, ready to rock and roll. So, I'm gonna slide everything over and make sure that I have a sterile field to work with. So I've got my garbage can down here, and I'm going to wash my hands and get ready to rumble. Okay, now learn how to open one of these. Okay, so this is going to be, the other thing is this is pretty exposing, so I'm going to provide some privacy for Alice in the beginning before I even started this. Okay, this is my garbage can that I might use or I might not. Just depends how I feel once we get rolling around here. Okay, so the first thing I'm going to do is this is my sterile field. So I'm going to open my catheter thing away from me and just touching the corners. I shouldn't have leaned over. I couldn't see the corner. Okay, very good. Don't lean over it. Sterile. This has a hole in it, which is not good because I've never opened this before, but it has a hole in my sterile field, so I'd get a new one. But I don't have a new one, so I would get one, or I wouldn't do it. But I'm going to do it anyways. Okay, so the next thing I'm going to do is I'm going to grab my gloves, and I'm like standing away from my sterile field because I don't want to contaminate it with my contamination. So I'm going to open my gloves, and I'm only touching my sides because I want to make sure that this stays sterile. So the first thing I'm going to do is I'm going to grab my glove, and I'm only, these are stuck together. I'm only touching the inside of my glove, and I'm putting it on away from me. And then with this glove, I'm going to grab the inside of this one and put it on. And now I have my sterile glove, so now I don't need that. And I'm going to keep this, my hands up. I'm going to keep my everything very close and not break my sterile field. So the first thing that I'm going to do is I'm going to move my box because my hands are sterile now, so I can actually do stuff. Okay, so I'm going to put this chuck underneath Alice. So I'm going to wrap it in my hand so that I can stick it on Alice, and my back is not turned. I can still see everything happening on my sterile field, and I'm not touching Alice. I'm not doing anything like that. I'm just putting it underneath her so that we are good to go. And then I'm also going to put this shield on Alice, opening it away from me, not touching anything. And it creates a nice little place for me to work. Okay, so the next thing I'm going to do is get ready. What's my time? Sorry.
You're at 5 minutes and 20 seconds.
Okay, perfect. I only asked that because I'm running out. Enjoy, I'm not deleting my wedding video. So I have to go quick. Okay, so I'm opening my lube and getting that ready. I'm gonna open up my thingy, my swab sticks, and I'm not moving my hands. This is all sterile, so I can touch it however I want because it's sterile. Alice is just a super patient and is not talking. She's just really excited to learn. So I'm going to hook off my thingy that fills my water, or that fills the balloon. Hook that up so I'm ready to go. And then I'm going to pull this from the bottom to the top and just don't let anything happen. I'm gonna drop that so that all is well. And I'm going to stick my tube in the lube so that it's ready to go, and then I'm gonna leave that. So the next thing I'm going to do is get ready to clean Alice. So I'm gonna pull all of these out, keeping that above my waist, and start cleaning. So I'm going to clean from the right side down, throw it away, not below my waist. The left side down, throw it away, not below my waist. And then I'm gonna clean from the middle and go down, spread. I didn't just swipe that. I'm gonna spread it, and then I'm going to wipe it, and then I'm gonna throw it away. And now this hand is not sterile, this hand, because I'm touching it, so now this hand is like glued to Alice, so I can't do anything now. So now I'm ready to insert Alice's catheter. So I'm gonna pick up my little box, and I'm gonna bring it over here because it's sterile, so I can. So I'm gonna take my lube, and I'm not gonna touch the tip of this, but I kind of am, but I'm not really. Okay, so now I'm ready to insert the catheter. So I'm gonna tell Alice, okay, this is like, I'm about to put it in, so I just need you to relax and take some deep breaths, and I'm gonna insert it now. So I'm inserting it. Oh yeah, that doesn't go very far. Okay, so I'm going to pretend that that is all the way up until I get some urine return. Once the urine comes through the tube, then I'm going to push it 2 inches further to make sure that I'm in the right placement. And then I'm going to tell Alice, okay, I'm just going to add a little bit of water in here to make sure that that stays in there. So I'm going to push and add what I need to. So I'll just push until it like feels good. Okay, so I put 5 things of water in there. So then I pull, and it's pretty secure in her, so I don't need to do anything. I'm just gonna unhook this and put it there. So now I know that I put 5 in there, so I'll chart that so the next person knows how much to take out. And then Alice, how's that feel? Good? Great. Alice like doesn't really like me because why would she? And I'm gonna clean that up, and Alice is good to go. I'm going to hang Alice's catheter bag on. Oh my gosh, why did that happen? Okay, rewind. Okay, pretend I put that in there, and okay, so her catheter's in here. This was all sterile filled, still had the thing on. I'm gonna push her thing to, it's because it's like leaking out.
Yeah.
It's okay, don't talk to me. Like, sorry, not being mean. You're fine. Okay, so the balloon is in now. Alice, we're all good. Okay, so now I disconnected that and put it back. That would not have come out, but pretend it didn't. And then I'm gonna hook this to her bed frame, not her rails, because then when it starts going, it's gonna be bad. Okay, so now Alice is all good. I'm throwing away my stuff. I don't need a sterile field anymore, yada blah blah blah. Okay, so I would cover her up, all is well, but then I need a urine sample, so I don't know if that was this time or next, so if it wasn't, I would do my beginning procedures again. Come in and tell her I need a urine sample, and it depends how long the catheter has been in. So if the catheter has been in for 30 minutes or more, I can take her sample from her bag, but if it hasn't, then I would need to take it from the port. So to take it from the port, I would grab an alcohol wipe off this area. Depending on if I came in or just kept on going, I would have new gloves, but we're just gonna say I put new gloves on and I'm taking her thing. So I would clean off her port and take it with a 10mm syringe, stick the needle in there and pull it back. And then I would put it into this container, put a sticker on it, and take it to the lab and make sure that the sticker matches the sticker that I put on the bag to make sure that it's the right patient's urine. But if I took it from the port, I would have clamped this catheter like this, and I would have made sure that I didn't clamp it for more than 30 minutes. I just took my urine sample, took it off, and I unclamped it. So that's the port way. If I was gonna do it from the bag way, I would take this, have my sticker on it, come down here, and take this bed. I would take my catheter and not have it touch my thing at all, and then I would, can you see? Then I would push my thing and let the urine drain out into this till it was however much I needed or whatever, and then I'll clamp it back off so the urine's not coming, and then put it back up. So this hasn't like been in the bag, so it's not unsterile, and I didn't touch it on the rim of this, so we're good. Then I'm gonna wrap or put the lid back on, take the sticker, take it immediately to the lab, document everything that has happened. If I notice any abnormalities or bleeding or odor or whatever, I'm going to document everything that I did, going to document how Alice responded to it, document how I responded to it. I would cover Alice up and put her in a comfortable position and cover her back up, and the end, I'm done. Okay, so now, now I'm coming back in because the doctor has asked me to discontinue Alice's IV. So, I'm coming in, I'm a brand new nurse now. Knock, knock. Introduce myself to Alice, let her know that the doctor has said she could get that catheter out, so woohoo, we're on the mend, good things, good things. And I would explain to her how I'm gonna do it, ask her if she has any questions, wash my hands, bring my equipment, get gloves. I don't have rings on or anything. Otherwise, when I was taking her stuff off or whatever, I would have taken them off, but I don't have rings. Shiz. I didn't say that. Okay. Maybe I'm not as small. Extra small. I really wish I was, so I guess I'll just keep on shoving these on my hands. But probably learned my lesson in this video that I should not be an extra small. Very good. So Alice is comfortably positioned because her awesome nurse left her that way. So I'm going to come back in and say, hi Alice, blah, blah, blah. I already said that, so I'm not going to say it again. Okay, Alice, I'm going to take out your catheter. So, yay. Okay, so I washed my hands, I got my gloves on. I'm going to check the orders, and what's her bucket nurse put 5 milliliters or 6 milliliters in, so I'm going to insert my thing and pull all the water off. I'm going to pull off and shoot all my water into the garbage can. I don't even know if this is water, saline, whatever it is. Pull back and just make sure, because I don't want to hurt Alice's system. So I want to make sure I get all the water out. And then I'm going to gently pull this out till, wow, that was not far in. Okay, pretend that was way farther in. And I will keep my tip up, and then I'll just grab my bag so that I'm not contaminating anything. Put it in a biohazard bag because it has all of Alice's fluids on it. And then I'm gonna ask Alice, do you feel good? Do you need anything? Nope, Alice is great. Happy to have that. Happy to have me leaving. Wrapping her back up like a present, tucking her in bed. Alice, any questions? Nope, Alice is great. I'm gonna document everything that happened, document her response, and clean up my mess, throw everything away, take off my gloves, go sit down and chart.